Hello, everyone. This is Mike Hayes from the Clinical Informatics Department. Today I have Holly Galbraith with me, Clinical Manager down in, is it CAA now?
Yes.
Yes. All right, perfect. We are going to look at the admission nursing handoff between CAA and the unit's nurses here. Just make some clarifications, minor change here and there, but just to make sure everybody's on the same page. So just to go through kind of how these workflows work, we have these different swim lanes. On the top here is the referral source. So in this case, most of the time, this is like the ER, right, Holly?
Yes.
And the middle lane would be the bed placement coordinators, and the bottom lane is the inpatient RNs. So if we're starting from the top left, but at the start here, we just have a patient that shows up at the ER or whatever the referral source is, and they have some sort of safety issue that would qualify a referral coming to us. So when we receive that information, we have a whole new process that we are going through to work these referrals, not only in Avatar, but just between the new kind of PAS staff, which is the patient access staff, and for registration, and the clinical support staff down there in the call center. So once we've decided, or once that referral has gone through that process, we come to a point where your team is looking at these referrals and saying yes or no, right?
Yes, and this is the part before the approval, we're looking at if the patient, whether or not the patient is meeting level of care. We're looking at any risk factors, like if they have been here before, if they were on special obs, if they were in restraints, if they have an alert in the system. We're looking at all their medical documentation, making sure they have the proper lab work. If they need to be reviewed by the medical team, we're scanning to them. If they need to be reviewed by a treatment team because of their acuity, we're scanning to them. So there are several different parts to this piece, especially if the patient has red flags in certain areas. But after we meet all those checklists, they've got all their labs, they've got their COVID, and everyone has approved. Dr. Jeffries approves them for admission, and then we tell the referral source yes.
Perfect. And some of this information before our go live, a lot of it was like kind of in that pre-admit, right?
Yes.
And now we are using a new form in Avatar called the Call Intake Referral Checklist. So if you're looking for more of this information that Holly and her team are gathering, look in your chart view in Avatar under Call Intake Referral Checklist. We would give everyone read access, but Holly's team and the other staff down in the CAA department area, they are in and out of those forms very often. And if we give you read access to that, where you're looking at the form, it actually locks everybody else out of
We're going to be very frustrated.
Yes, yes. We're very fast down there.
And so in that form, on the main page, I guess, the first page that you click on, you can find like where the patient's coming from, all the documents that we've received, when they're financially accepted, clinically appropriate, all of that. But where you really want to look is in the notes section, because that gives a play-by-play of basically every call we've made to the referral source requesting information, and every time they've contacted us. So if there were any red flags about when we were approving the referral, it'll be in there. So always check out that notes section.
Perfect, perfect. All right, so now we've gotten the approval. Your team is contacting the ER, and if you're doing this nurse to nurse there, right?
Yes.
Okay.
So yes, we do the nurse to nurse. I encourage everybody, any patient that once we give you that call and say you're getting this patient, the nurse to nurse is in, I encourage everybody to read that. There's a ton of information in there. It includes the presenting problem, any restraints or emergency meds they've had at the ED, any elopements, any physical medical problems, any skin problems, any PRNs they've received. Usually it has their home pharmacy, any scheduled meds they received at the ED, recent vitals. It'll have their guardian information if they're a minor or if they're an adult with a guardian. It tells you how long they've been at the ED. It's got a whole lot of information that's super helpful, especially since you guys are now doing the admission assessment. And obviously, if you guys, once you read that, if you have a question about anything in there, you can call down to the bed placement office and we are more than happy to answer those questions.
Perfect. And so in this workflow, we see create nurse to nurse and avatar, call to the unit RN going down. And then just the basic information that I think that you probably already do or you're going to start doing is just saying nurse to nurse is in and giving name, age, reason for the hospitalization and like a basic ETA. So if we come back up to the middle lane and we're looking at the patient arrives, right now the bed placement coordinators kind of receive the patient and you're doing these things in this box, right?
Yes, and also at this point, the clinic coordinator is given a call out to the unit to let you guys know that the patient has arrived. And then we're doing the skin assessment and contraband. So we're looking for obviously any kind of sharps or anything they could hurt themselves with. And also rashes, bruises, cuts, any kind of infection control issues with the skin. We are verifying their allergies. We're doing a set of vitals. We're making sure, I always ask them, we usually know ahead of time, but we usually ask, are you detoxing from alcohol or any substances? And if they say yes, we would do a COWS or a CEWA accordingly. And at that point, we bring the patient out to security and start our process. And this is the point where now we're going to be calling the unit, because at this point, after spending that time with the patient, we're going to know if they brought any contraband in, if they're very psychotic, if they're in need of some detox medications, if they're a fall risk for some reason and that wasn't addressed in the nurse to nurse, if it's something that's a surprise to us, we're going to be making the call to you guys, letting you know anything different from the nurse to nurse and if we are giving them any PRNs.
Your team will be calling up to that unit RN, even if there are no differences with this basic information about name, age, reason for hospitalization, all these things listed on the top right.
I don't know if you guys look at the face sheet on top of the yellow folder, but it's going to have your vitals, your allergies, all of that stuff. Just if you want a quick glance before you get a chance to get into Avatar, when like maybe when you come get the patient, it also has a checklist. So if they haven't seen the LIP or they didn't get to see the psych provider, that will be not checked on that document. So that's just an easy, quick look at what has happened. It'll also have the medications given, which again, all this is an Avatar, but if you just want like a brief, quick check, that face sheet on the top of the yellow folder is a really good resource as well.
So thank you, everyone. And we look forward to talking with you soon.